Welcome to Lux Scout Psychology. Have you ever felt overwhelmed by intense emotions, like your relationships are a roller coaster of highs and lows? Borderline personality disorder, or BPD, is a mental health condition that affects how you feel about yourself and others. It impacts your mood and behavior, often causing instability in everyday life. People with BPD often experience deep feelings of insecurity and fear of abandonment. They might struggle to control their emotions, leading to impulsive actions and unstable relationships. While it can be challenging, it's important to remember that BPD is treatable. With proper support and therapy, individuals with BPD can learn to manage their symptoms and build fulfilling lives. Unfortunately, BPD is often misunderstood, leading to stigma and judgment. Some believe individuals with BPD are manipulative or attention-seeking. This is not true. BPD is a complex disorder rooted in both biological and environmental factors. It's not a sign of weakness, and it's not someone's fault if they have it. By increasing awareness and understanding, we can create a more compassionate and supportive environment for those living with BPD. It's time to break down the stigma and replace it with empathy and accurate information. Imagine feeling an overwhelming terror at the thought of being alone. This intense fear of abandonment is a hallmark of BPD. Individuals with BPD may experience this fear even when separation is temporary or imagined. They may go to great lengths to avoid being alone, such as clinging to others or constantly seeking reassurance. This fear isn't simply about being physically alone. It's rooted in a deep-seated fear of rejection and a lack of belief in one's own self-worth. This underlying fear can significantly impact relationships, often leading to behaviors that, while intended to prevent abandonment, can unintentionally push others away. Life with BPD can feel like an emotional roller coaster, with intense and rapid shifts in mood. One moment, an individual might feel happy and content, but within a short period, they can experience overwhelming sadness, anger, or anxiety. These mood swings can be triggered by seemingly insignificant events, like a casual comment or a minor change in plans. This emotional volatility can make it difficult for individuals with BPD to manage their feelings effectively, leading to difficulty in interpersonal relationships, work, and daily life. Relationships are often a source of both great joy and intense pain for individuals with BPD. Their view of others can fluctuate between idealization and devaluation, also known as splitting. They might put someone on a pedestal, seeing them as perfect and wonderful, only to later view them as entirely bad or worthless. This instability extends to their sense of self. People with BPD often struggle with a distorted self-image and lack a stable sense of identity. They may feel empty, lost, or unsure of who they are, leading to frequent changes in values, goals, and even career aspirations. Impulsivity is a key characteristic of BPD, often manifesting in risky and self-destructive behaviors. This can include substance abuse, reckless driving, binge eating, unsafe sex, or impulsive spending. These behaviors are often a way to cope with intense emotional pain or feelings of emptiness, but they ultimately provide only temporary relief and can exacerbate existing problems. It's important to remember that these behaviors are not intentional attempts to hurt themselves or others, but rather desperate cries for help and a way to manage overwhelming emotions. What causes borderline personality disorder? It's a complex question with no easy answers. Research suggests that BPD is not caused by any single factor, but rather a combination of genetic predisposition and environmental influences. This means that individuals may be born with a genetic vulnerability to BPD, but the disorder is typically triggered by stressful life events or experiences. Think of it like a seed. The seed represents the genetic predisposition, and the environment, like the soil, water, and sunlight, represents the experiences that can either nourish or hinder its growth. Understanding this complex interplay is crucial for developing effective treatment strategies and reducing the stigma associated with BPD. Early childhood experiences play a significant role in shaping our emotional and psychological development. For individuals with BPD, traumatic experiences during childhood are often a significant contributing factor. These traumatic events can include physical, emotional, or sexual abuse, neglect, witnessing violence, or experiencing the loss of a parent. These experiences can disrupt a child's sense of safety, security, and trust in others, leading to difficulties regulating emotions and forming stable attachments later in life. It's important to note that not everyone who experiences trauma develops BPD. Individual resilience, genetic factors, and the availability of support systems also play a role. Research has identified specific areas of the brain that function differently in individuals with BPD, particularly those involved in emotional regulation, impulsivity, and interpersonal relationships. For example, studies have shown differences in the amygdala, which processes emotions, and the prefrontal cortex, which controls impulses and decision-making. These brain differences are not the sole cause of BPD, but likely contribute to the challenges individuals with the disorder face in managing their emotions and behaviors. Further research in this area is crucial for developing more targeted and effective treatments. If you suspect you or someone you know might have BPD, seeking professional help is essential. Early intervention can make a significant difference in managing the condition effectively. Diagnosing BPD requires a comprehensive evaluation by a qualified mental health professional, such as a psychiatrist, psychologist, or licensed clinical social worker. This evaluation is crucial to understand the full scope of the individual's mental health. The diagnosis process typically involves a thorough clinical interview, where the individual's symptoms, medical history, and family history are discussed in detail. This helps the clinician to gather a complete picture of the individual's mental health. The clinician will assess the individual's experiences and behaviors against the criteria outlined in the Diagnostic and Statistical Manual of Mental Disorders, DSM-5. This step ensures that the diagnosis is based on standardized guidelines. It's important to remember that self-diagnosis is not recommended. Self-diagnosis can lead to misunderstandings and incorrect assumptions about one's mental health. BPD shares symptoms with other mental health conditions, so a professional evaluation is crucial for accurate diagnosis and appropriate treatment. Only a trained professional can differentiate between these conditions and provide the right guidance. There is no one-size-fits-all approach to treating BPD. Treatment plans are individualized based on the individual's specific symptoms, needs, and preferences. The cornerstone of BPD treatment is psychotherapy, also known as talk therapy. Psychotherapy provides a safe and supportive space for individuals to explore their thoughts, feelings, and behaviors, and develop healthier coping mechanisms. In addition to psychotherapy, medication may be used to manage specific symptoms, such as depression, anxiety, or mood swings. Medications are not a cure for BPD, but can be a helpful tool in conjunction with therapy. A comprehensive treatment plan might also include group therapy, family therapy, or support groups. Several types of psychotherapy have been proven effective in treating BPD. One of the most well-established and researched therapies is dialectical behavior therapy, or DBT. DBT focuses on teaching skills to manage intense emotions, reduce self-destructive behaviors, improve relationships, and increase mindfulness. Another effective therapy is cognitive behavioral therapy, known as CBT, which helps individuals identify and change negative thought patterns and behaviors that contribute to their distress. Other therapeutic approaches, such as mentalization-based therapy and schema-focused therapy, can also be beneficial for individuals with BPD. While medication alone cannot cure BPD, it can be helpful in managing certain symptoms that often co-occur with the disorder, such as depression, anxiety, mood swings, and impulsivity. Antidepressants, mood stabilizers, and antipsychotics are among the medications that may be prescribed, depending on the individual's symptoms and medical history. It's crucial to remember that medication should always be used under the close supervision of a qualified psychiatrist. The psychiatrist will work closely with the individual to determine the most appropriate medication, dosage, and potential side effects. Open communication between the individual, therapist, and psychiatrist is vital to ensure the effectiveness and safety of medication management. The good news is that BPD is treatable, and with proper support and commitment to therapy, individuals can experience significant improvement in their symptoms and overall quality of life. Many people with BPD find that their symptoms lessen in intensity and frequency as they age and gain more experience managing their emotions and relationships. While challenges may arise throughout life, the skills and insights gained through therapy empower individuals to navigate these challenges with greater resilience and self-awareness. Remember, recovery is not a straight line, but a journey with its ups and downs. The important thing is to keep moving forward, one step at a time. It's important to acknowledge that the road to recovery from borderline personality disorder, or BPD, can be challenging, and setbacks are a normal part of the process. Recovery is not a linear journey. It has its ups and downs, much like a winding path through a dense forest. Life events, stress, and relationship difficulties can trigger symptoms even after significant progress has been made. These triggers can sometimes feel overwhelming, but they are a natural part of the recovery journey. These setbacks are not failures, but opportunities for learning and growth. They provide a chance to understand oneself better and to develop new strategies for managing emotions and behaviors. They highlight areas where additional support or adjustments to treatment plans may be needed. This might involve working closely with a therapist to refine coping strategies or exploring new therapeutic approaches. During these times, it's crucial to reach out for support from therapists, support groups, loved ones, or other trusted individuals. Building a strong support network can make a significant difference in navigating the challenges of recovery. Remember, you don't have to face these challenges alone. Seeking help is a sign of strength, not weakness. With each challenge overcome, individuals with BPD gain valuable coping skills and build resilience, ultimately strengthening their ability to manage their emotions and create a more fulfilling life. Every step forward, no matter how small, is a victory worth celebrating. Several factors can significantly influence the long-term well-being of individuals with BPD. A strong therapeutic alliance, characterized by trust, empathy, and collaboration between the individual and therapist, is crucial for successful treatment outcomes. Active participation in therapy, including consistent attendance, engagement in exercises, and open communication with the therapist, is essential for maximizing the benefits of treatment. Building a supportive network of friends, family members, or support groups can provide invaluable emotional support, understanding, and encouragement throughout the recovery journey. Engaging in healthy coping mechanisms, such as regular exercise, mindfulness practices, creative pursuits, or spending time in nature, can help regulate emotions, reduce stress, and enhance overall well-being. As we've learned, borderline personality disorder is a complex mental health condition marked by intense emotional experiences, relationship struggles, and challenges with self-image. It's important to remember that BPD is not a sign of weakness, nor is it anyone's fault. With increased awareness, we can move beyond the stigma and misconceptions surrounding BPD, fostering empathy and support for those who live with it every day. Effective treatments, such as dialectical behavior therapy, DBT, and cognitive behavioral therapy, CBT, provide individuals with valuable tools and strategies to manage their emotions, improve relationships, and build meaningful lives. Remember, recovery is a journey, not a destination, and setbacks are a normal part of the process. While we've made significant progress in understanding and treating borderline personality disorder, BPD, there's still much work to be done to ensure everyone gets the help they need. Continued research is crucial for developing even more effective treatments and improving the lives of individuals with BPD. This research can lead to breakthroughs that offer new hope and better outcomes. Equally important is our collective responsibility to challenge the stigma surrounding mental illness and create a more compassionate and supportive society. By doing so, we can foster an environment where individuals feel safe to seek help. By engaging in open conversations about mental health, sharing accurate information, and dispelling myths, and supporting organizations dedicated to mental health advocacy, we can amplify our impact. Together, we can make a difference in the lives of those affected by BPD. If you or someone you know is struggling with BPD, it's important to recognize the signs and seek help early. Please remember that you are not alone. There are many who understand and are ready to support you. Reach out to a mental health professional, a trusted friend, or a family member. Help is available, and recovery is possible. Don't hesitate to take that first step towards healing. Please like the video and share it with others. Thank you for watching.